there's often a lot of confusion about screening and diagnosis. So they're not the same thing. And can you elaborate on the differences?
Yeah, I think this is such a good question because it really can be hard to wrap your mind around that screening and diagnosis are very different things. So, screening tests are primarily used for early detection of a disease or a risk factor. So, a positive screening test does not mean necessarily that you have that cancer or whatever disease state we're screening for. We need a diagnostic test then to tell us that. That's the more specific test that will tell us if it's true or not. So screening tests are almost always followed up with a diagnostic test to find out if someone really does have that cancer. So, for example, a mammogram is a screening test for breast cancer. If someone has an abnormal mammogram, they need additional diagnostic tests to find out if that's real or not. Something like more images of the breast or biopsies of the breast tissue to look at those cells under a microscope and see if they have cancer.
Mm-hmm. So you think of a positive screening test as kind of like a caution, maybe.
Right. Yeah. A positive screening test means we need to look further to find out if something is there or not.